how do I help these people who aren't clients but are the local people? And actually, that's where my heart is now.
Hi everyone, and welcome back to the High Impact Medicine podcast, the podcast that chats to medical doctors pursuing diverse career paths and leading impactful and meaningful careers. Today's episode is a little different from usual, as our guest is an expedition medicine doctor. He's early in his career and is now making a transition towards humanitarian medicine. We discuss his journey and focus mostly on his experience of expedition medicine. And although expedition medicine isn't classically a high-impact cause area, I think hearing his thought process and his shift towards humanitarian medicine is really insightful. So yes, today's guest is Dr. Benjamin Alba. He's an emergency medicine doctor with experience in expedition medicine and recently worked a whole season at Mount Everest. He graduated from Cardiff University in the UK and has gone on to pursue a career path well beyond the UK hospitals. He's also the founder of Ubuntu Network, a space for expedition medical doctors to share their experiences of their expeditions and collaborate with each other. So, welcome to the podcast, Dr. Benjamin Alba. I'm very excited to talk to you today.
Thanks for having me. It's a great pleasure.
Before we begin, let's set out a couple definitions for our listeners. I personally haven't met an expedition doctor before, so I don't know very much about what this involves, and I will be learning along with our listeners today. Can you tell us what an expedition doctor is?
Sure. So I guess expedition medicine is kind of not really been defined as such so far, but essentially it's a doctor or sometimes a medical practitioner, so it can be a physiotherapist or a medic of any background, like a paramedic, working in the expedition environment, which I guess would describe as kind of an austere or isolated area that's kind of out with of the kind of normal hospital environment that we normally operate in. I guess it provides a different challenge than normal hospital medicine in that you have limited resources. And you're kind of going in, albeit with preparation before, you're kind of going in a bit blind, and you kind of have to manage during it. And then you've got kind of the post expedition care afterwards, which is a bit different to normal care. It's all kind of dependent on your follow-up. So I guess to summarize, it's your kind of practice taken outside of a normal clinical setting into the outdoors, essentially. That's probably the best way of putting it.
Okay, yeah. And what is the range of environments you could be working in? Just to give us an overview. Kind of set the scene for us.
Yeah, I guess we can kind of split this into biomes. So you've got the Arctic, Antarctic area, so they're kind of polar regions. They're definitely kind of a possibility where doctors are working, like at the British base in Antarctica and things like that. Then you've got desert medicine. There's jungle and tropical medicine. Obviously, there's a diploma and masters you can do in the UK that's quite focused on that. You've also got kind of altitude environments. So high altitude above 2,500 meters, which is kind of a particularly common environment where expedition medics work, purely because of the growing market in kind of trekking and mountaineering, etc. And then there's also kind of some really niche ones, like there's dive medics who work kind of off boats and things, and in kind of tropical areas. So dive medicine's becoming a bit bigger and maybe isn't so much associated with the kind of the UK, but definitely within the army. And there's also a company down in Plymouth called the DDRC that do a lot of dive medicine. So yeah, I guess it's quite varied. Any kind of biome you can think of. There are expedition medics working there, either for teams or for kind of filming purposes. So it's quite diverse, and obviously that means you kind of need to have a bit of a breadth of understanding of different things too.
Okay, yeah, so it's very varied. So let's take it back a notch now and think about the start of your career, from medical school to where you are today. What's your journey been like?
So like you said, I went to Cardiff University. I studied for 5 years. And I graduated in 2018. I moved to West Wales, so a little town called Haverfordwest on the Welsh coast, and worked there for F1, and then moved back to Cardiff for F2. I did a mixture of kind of ED, gen med, gen surgery jobs, and a cardiology job, which I really loved. And then that's kind of when I got started with thinking about expedition medicine per se. I covered the Spine race, which is a race in the north of England. I kind of got interested in covering long distance races as medic and seeing what that kind of was like. And mainly it was to do with bad feet, blisters, and people managing their own kind of chronic health conditions like diabetes and things. So supporting with that, and then also kind of like the psychological stuff of getting these guys through the big races and just like kind of giving them a helping hand. Having been a kind of person who loved to hike and walk and play rugby and all that kind of stuff when I was a kid, I kind of had an awareness of the outdoors and was quite kind of keen to get involved with that kind of thing with medicine as well. And then obviously the end of F2 was 2020, so that's when COVID started. I went to Bristol as an ED SHO, and then I moved to Bath as an ITU SHO. And during that year, I did a diploma in expedition and wilderness medicine, which was my choice. There are a number of different diplomas available out there of varying kind of cost and degree of expertise. The reason I chose the one I chose was because I knew that I needed to kind of get some learning on board and kind of have some confidence in myself. If I was going to go out there and say, look, I'm an expedition medic and I want to kind of help out with your expedition, I knew I kind of needed some like nous to that rather than just saying, look, I'm a doctor. Because as we know, there's lots of different types of doctors. So I did that during COVID. And then just as kind of COVID finished, I moved to Scotland and worked in the north coast of Scotland in a place called Caithness for 10 months. And that kind of paired with my work in West Wales, like really kind of, it's just a real different way of working. Small hospital, it was 60 beds. The ED had like maybe 30 to 40 presentations a day, but was anywhere from kind of, splinter in your finger to kind of, someone who jumped off the top of a building. So really limited resources, lots of transfers to kind of bigger centres like Glasgow or Inverness and things. So really kind of brought home the idea of like managing care and clinical decision making and stuff like that. And at night, it was you kind of working alone at night with kind of consultant support, like kind of a phone call away. So that was kind of a big introduction to like working alone and kind of getting stuck in with cases and trying to think clinically about the picture. I think in bigger hospitals, from my experience in like trauma centres and things, where obviously we need to go through scanners and things, but scans are used a lot more kind of frivolously than they are kind of up in Scotland where you don't even have a scanner overnight. So that was a really interesting time, and I learned a lot up there. And then just towards the end of that, I got my first abroad expedition job. So I did Everest Base Camp with an Irish company. And yeah, it was really challenging. My first expedition as a doctor. I was really nervous. Did a lot of preparation for that, kind of in terms of looking into kind of the kind of clients that were coming and their medical history and things, asking questions. So I felt I was kind of on board with it. And yeah, there were some tricky cases in that, but we kind of got through. And I've actually made lifelong friends from that. The guide I was with was amazing, and we're still in touch and still see each other, which is great. And then I moved to New Zealand and worked in kind of rural New Zealand for 10 months, again at a small hospital. And I was an ED reg there. So I was kind of in charge of the department at night with a small team of kind of juniors with consultant support at home again. And again, saw loads of cases. New Zealand, if you don't know, is quite a rural country. There's a lot of kind of areas that aren't covered by healthcare, and was actually involved with a couple of kind of incidents out in when I was just driving around, kind of touring and stuff, like a bike accident, had to help by the side of the road. And again, all those kind of skills from Scotland and working in West Wales and that expedition mindset kind of came into the fore, which is really cool. And then I finished in New Zealand, and that's when I got my big job, really, when I went to Everest and worked there all season for a company in New Zealand. And that was, really challenging, a really long expedition, 3 months long, obviously working in very, very kind of remote area. But again, kind of bringing home that pragmatism. We had very limited resources, and getting patients out when you needed to, and making that kind of decision, that judgment call, with a really good like team of supporters around me who weren't doctors, but like were people who had been in Everest and been around that kind of area for a long time. That was really, really useful. And that kind of gave me the confidence to come back to the UK and become an ED Reg here. So I've been a middle grade in Cornwall for the last 6 months. And it's been great. I've really enjoyed the kind of the challenges and the ups and downs of my career so far, and hopefully it'll continue like that.
Yeah. Also, just wanted to jump in here and clarify those terms. So, F1 and F2 describe any doctor who is part of the UK Foundation programme, which is typically 2 years of training straight after medical school. Thank you, Dr. Alba. That was a very comprehensive overview, and it's really interesting to see how it's taken you all over the world, and also how the way that your training jobs actually also helped you with expedition medicine, kind of where you did them, and the departments that you chose to do them in actually were quite useful experiences for you when pursuing expedition medicine.
Definitely.
Can you tell us a bit about your experience working as an expedition doctor on Mount Everest? That's definitely something that's very impressive and seems like a once in a lifetime opportunity. But as an expedition doctor, what's that been like?
Yeah, I mean, definitely it was a once in a lifetime opportunity. Like, it was unbelievable. I managed to get the job very luckily by knocking on this man's door, basically, because I knew they weren't working during COVID, and I was like, oh, they're going to need a doctor, so I might just go put down there in my van and knock on his door, and it kind of worked out quite well, which was amazing. But yeah, I mean, Everest was really challenging kind of cases. So saw some really interesting stuff. Saw some high altitude cerebral edema, saw some high altitude pulmonary edema, saw a bit of frostbite, and unfortunately, a couple of guys have lost fingers from that as a result of it. And on account of the other podcast that I did, unfortunately, was involved with a death up on Everest, which was quite difficult to be involved with. But I'm glad I was there for that, and I was able to kind of offer some support to the guys who were dealing with it on the mountain. And even though I was only talking to them by radio and having that debrief afterwards, I just felt kind of like it was a really important thing to do. And actually, I hope that they were really grateful for it, and I was really grateful to be asked to be involved. And I guess it kind of shows that camaraderie of kind of the Everest region, and the people interacting is on the whole very nice, and people really do respect each other, which is great. I think as well, what's really kind of shone forth for me kind of since then and reflecting on that experience was working with the local populations is just like so important. And I've worked in Nepal now twice with the Sherpa and the Rai, and they're just phenomenal people, and they work so hard, and their lives are so different to our lives. We can't even comprehend here like what their lives are like. And they go from this Everest expedition, they decompress, and they go back to their local villages and do whatever it is they do, like farming and living with their families and stuff, and they gear up again for next year, and they come back, and they risk their lives every year for clients, and I don't know, I just feel like that was a big part of the reason why I enjoyed Everest so much, and those people made it for me. And just being able to give a little bit back to them, like they don't get a doctor kind of looking after them in their village every week, and just being able to kind of look after them and feel like they were part of the family was really cool. And I guess I kind of really enjoyed that. That's kind of what I've enjoyed mostly from my rural work as well. So working in New Zealand with the Maori, working in the north coast of Scotland with rural communities, very isolated communities, working in West Wales with like West Walian communities. I think that's actually brought a lot of satisfaction to my career, opposed to kind of big major trauma centres where there's hundreds of people coming through the door every day. I think that personal kind of touch is actually just something that I don't know, just really speaks to me on a kind of human level, which is nice to appreciate.
Yeah, I think that's a really interesting point, the idea of working with local populations, because especially in my head, when you think of an expedition medicine, I think of you catering purely for the clients that are climbing that mountain. But actually, the Sherpa, they have a lot of much of local knowledge and things that maybe you can even learn from, and then you in turn can then help them address medical needs because you're already there. And it's I guess like one doctor in thousands in a region like that. So that's really good to hear.
That was really it was really nice to get involved, I guess, nosily in their lives and kind of tease out some things and see if we can help a little bit. But again, they're such stoic people, and like they don't want help. They don't want us to help them. They like, and as you say, the main focus is the clients. That is what my job was. My job was to look after the clients, but also my job was to look after our team and all of us in the team. And that was I took a lot of pride in that, and it was really enjoyable.
So managing very kind of acute settings. You mentioned like cerebral edema, pulmonary edema, and that reminded me of I remember reading a book before I applied to medical school called Life at the Extremes. by Francis Ashcroft, and I don't know if this might be interesting for any listeners, but it's a book about kind of what happens physiologically to the body when we go to different extremes, whether it's altitude, diving. I remember reading about like nitrogen bubbles that form in our blood when we start diving. So if anyone's really interested in not wilderness medicine, but just kind of what happens to your body when you go to these extremes, it's a good book. And also another thing I wanted to mention was the World Extreme Medicine podcast, which Dr. Alba just mentioned. So he's got a two-part episode on this podcast, which is a great listen for anyone wanting more details about the realities and challenges of being an expedition doctor, and specifically the Mount Everest expedition. So that's a good one. I'll link all of these in the show notes. Moving on, you are now, I think, in your F6 year. Is that right?
Yeah. Doesn't sound good, does
it? So how does being an expedition doctor affect your training pathway, and what are your future plans with training?
That's a really interesting question, and I think it's something that I've deliberated over a lot in the last kind of 4 years since I left foundation training. So as I mentioned, I did my foundation training in Wales, and then since then I haven't actually had a training post at all. I've been working in standalone jobs around the country and around the kind of the UK and also abroad. And for me, that's worked really well. I've been able to manage my own time. But there are some things to say for that. And I think there are some difficulties, there are some challenges with kind of making your own career. Namely, one of them is kind of keeping on top of being professional. I think it's very easy to kind of slip into the kind of, I'm on holiday. And I mean, don't get me wrong, I've had holidays during that time where I've just been off and not doing any work. But kind of keeping on top of your portfolio, making sure you're doing kind of KEXs, CBDs, all the stuff you do at medical school, but also carrying on that kind of through foundation and through into your career, making sure you're doing reflective practice, making sure you're kind of getting feedback from colleagues and stuff like that. That's all really important. And I can't stress enough how important that is for your appraisals every year. And also for your revalidation at 5 years, it's just what I have to do next year. So I guess the one point from that is definitely stay on top of your professional duties. And that can be a challenge at times. But I think the easiest way to do it is to just engage with teaching and engage with having a clinical supervisor at work and things like that. And it makes your life a bit easier. So the expedition medicine, I've kind of slotted in around that. So I have left jobs before like kind of the completion of them. So I've signed up for 1 year jobs and left at 10 months, signed up for 6 months jobs and left at 4 months, depending on kind of the situation that arises. And I've been very open and honest with my employers about that kind of, I'm taking this 6 month job, but I might be leaving kind of after 4 months because of whatever comes up. And they're usually pretty open to it as well. In terms of kind of education on the side, I've mainly done 80% clinical, 20% non-clinical jobs, and they've allowed me to kind of do other courses like ATLS, ALS, PLS, and my diploma alongside work, and they've been really supportive of that as well. And so there's loads of options, and I know that expedition medicine is kind of the topic of this conversation. But you could go out there and you could be kind of a medical education tutor. You can go and do a dive job at the DDRC in Plymouth. You can go and do a burns job in kind of Chelmsford, Essex way. And there's loads of opportunities out there that isn't just mainstream medicine. And I think the more time that we take and the more encouragement we take to kind of go and find those opportunities and really understand medicine and experience it for what it is, I think we can only make better doctors, really. I'm maybe not a big supporter of kind of pushing people into training schemes, but I guess there is a point and there's a place for it.
Yeah, I think definitely it feels like sometimes the path is almost a little bit too clear from go from one step to the other, and there are all these other avenues that we can explore, and actually taking the time to dip into these things early in your career is actually probably going to be quite high yield in the long term.
100%. I would say as well, like I said, from the kind of the learnings of each case, like I've enjoyed moving every kind of 6 months. That brings its own challenges, trying to reintegrate into a new department, seeing how different places work, different health boards, different countries, engaging with different like populations. I don't see how that isn't beneficial in kind of progression for a person, and also kind of bringing that forward for kind of your future career, essentially. So I really do advocate it, and I've met a lot of people. I mean, there's tons of like you hear it in the news. There's tons of doctors in New Zealand. There's tons of doctors in Australia. All my mates are out there, and we're all having good times. But we're also kind of like everyone's finding out little bits about each other and what to do, what not to do, and that's useful. It's really really good.
And do you plan on pursuing the path of expedition medicine in its purest form, or will you always try and do some work clinically in hospitals? Kind of what's your ideal?
So this is a really interesting question. So at the moment, you cannot be an expedition doctor on its own because there is no faculty or kind of overarching body that looks after us. So there is a bit of an abyss in that sense. So most expedition doctors are either anaesthetists or emergency medics or GPs, because essentially they're the ones that allow the most space and time to work outside of their kind of day-to-day hours or their training to do expeditions. Now, there are bodies like the Faculty of Pre-Hospital Care, and obviously kind of RChem, which is the emergency medicine body, which kind of would be great for overarching for the expedition medical kind of faculty. But as I said, as yet, there is no body to kind of sign up to be like, I am just an expedition doctor. I don't think there ever will be one that allows that, because the competencies to kind of be a doctor need to be ratified by the GMC, etc., for revalidation purposes and all that stuff. But I do think there could be a body kind of developed which would really, really support kind of expedition doctors. And that's kind of why I've built the Ubuntu Network, which is what you mentioned earlier, with a group of colleagues to kind of push that kind of agenda forward and bring together the community of people, so that we can kind of get some sort of standardization.
So this is a good time to move on to the Ubuntu Network, which is a network that you founded to help bring expedition doctors together for collaboration. I want to hear more about why you founded it and what it's for. But for our listeners, Ubuntu is an ancient African word meaning humanity to others, and it's often described as reminding us that I am what I am because of who we all are. Tell us a bit about what it is and what it does.
Sure. So the Ubuntu Network is a group of us. There's 5 of us who started this network. It kind of came off the back of the Everest expedition. I got home, had a really tricky case with the one that I described in the other podcast, about the chap who passed away. And I was thinking to myself, gosh, I've just had that really awful experience. But how can I share this with anyone? Because no one understands what I've just gone through, and no one can kind of not give me advice, but kind of no one can bounce ideas off me or say, oh, that was like you did the right thing, or that was, or you should have done that differently. And I thought, oh, that's really interesting. It's a very isolating job to be an expedition doctor, where you send a report off after the expedition, and then that's kind of closure. That's it. So I got chatting with a colleague of mine called Alex Taylor, who I used to work with in Bristol. And she put me in touch with a couple of other people. And so the 5 of us, Lucy Obolensky, Lucy Sykes, Alex Taylor, and Amara Cunning, all of us have kind of come together to form this network. And as you say, the aim of the network is to kind of bring together expedition medics. Currently, that is mainly aimed at doctors, but also nurses, physiotherapists, and all kind of practitioners, paramedics, etc. To kind of build a community and develop our own skills through interactive reflection. So we had our first meeting back in December, which was attended by 20 people. And essentially I presented a case, and then Lucy kindly chaired the meeting, asked a few questions, and then we opened it up to the group and had a big discussion about it. The main focus was on human factors and leadership skills, so not on kind of basic science or pathophysiology or anything like that. It's not a critique of the science of a case, but it's all about kind of the leadership skills required to be an expedition medic, and the decision-making kind of processes involved in those decisions. And yeah, it was a really interesting, stimulating conversation. The feedback was amazing. Loads of people took kind of really interesting points out of it, and I think it really would improve kind of our own reflection practices, and also kind of help each other to understand cases that might come up in the future. They're all real cases. They're not made up, and they're real scenarios that people have reacted to, and so it's likely that one of us or many of us will meet those again. So we had our next meeting a week ago, and although we didn't have as kind of the same number of people that we hoped we would, again, it was a great discussion, and lots of other different topics came up. And so the aim is to do this kind of every 3 months, to have a kind of webinar, and to move it forward and slowly grow the community. And yeah, this is just a free space for people to come and discuss interesting cases about wilderness medicine, and hopefully it'll take off.
Just a couple like practical points. Kind of how many doctors go on these trips? Are you usually the only one, or are you usually a team of doctors?
I guess it depends on the trip. So from my experience, I don't work in TV or anything, but from expedition side of things, usually it's just one practitioner. So when I went to Kilimanjaro, it was just me. When I went to base camp, I was the only doctor in the team, albeit there were 7 doctors at base camp looking after various groups and different people. And then again, when I went to base camp the previous year, it was just me. And most of the jobs are isolated. So again, it's a very isolating role. You do have the support of an expedition leader. So on the expedition will be someone whose sole role is to look after the expedition group and kind of manage the logistics of all that kind of stuff. And they've often got kind of a background in some form of medical training, whether that be kind of a wilderness medical course, or they might be kind of first aiders at work and things like that. So they have their own kind of standards of medical kind of expertise. But obviously you're a doctor, so, or you're a medical practitioner, so it's a bit different. But yeah, usually you're working alone. And again, that kind of adds to the pressure of what's going on, really.
Yeah, that's really interesting. And it sounds really stressful. I know it's something I probably would find really difficult, working in an environment that is unpredictable. It's new, it's low resourced. So that's really impressive. I was wondering, what are the main challenges of your job?
I mean, I think the main challenges are decisions around client interactions. So obviously a client has paid money to go on a trip, and your role is to obviously look after them kind of going throughout the expedition. And I think the worst thing a client can hear is that when you say, I think you should go down. And that point is really difficult, because so I've sent 1, 2, 3, 4, 5, 6. I've evacuated between kind of 5 and 12 people on various expeditions, and it's really difficult. That point where they realise this is over is very difficult to take, especially if you've given so much, whether that's money or time or family sacrifice or whatever it is. And for me to then say to them that you shouldn't continue because of a medical cause, it's almost like the body's giving up. So I think that's a really big challenge. But I think as well, that's again coming back to what we talked about, kind of education and learning. I think the key role of the expedition doctor is prevention. So I always say that the biggest thing you can do before you go on an expedition is learn about your clients as much as you can, as much information as you can. Prepare. Write down things that could happen, eventualities. Look at the route. Look at the altitude. How fast are you going up? When's this going to happen? When's that going to happen? Where's the oxygen? Where's the hospital? How do we evacuate them from here? All those things really, really help you when you get to expedition. And in fact, it probably makes it easier when you get on an expedition if you do all that, because essentially you know the setup, you know what's going on. And so preparation is 100% key to all expedition, I think, and it makes your life much easier. And it also makes those decisions really, really much easier, because you have an expectation in your mind, and if they don't meet that expectation or something goes wrong, then it's very easy to say, well, that's it. Like, this is the threshold and you've reached it, and we're going to say you've got to go down. And I guess those discussions are really, really complicated as well, because essentially they can say no. And then where do you sit then in terms of capacity? So if they say no and they're going against your advice is only your advice. You're a doctor, yes, but they can happily go against your advice. So and then you're dealing with a problem then because they refuse your advice. And so it's really interesting, the kind of dynamic of the expedition environment and the pressures that puts on you. Because you've got to think that these people they're not in their own house anymore. They're on expedition. Some people have never been in tents before. They've never been dirty before. They've never not had a shower for 5 days before. All that kind of stuff. The mental and psychological impact of that is really, really important as well to consider.
Yeah, so a lot of different skills there, like managing people's expectations, the importance of being very prepared before you even go out, kind of before you even leave the UK, doing your research, making sure you have all these mitigating circumstances kind of prepped. Wow.
Yeah, and again, that's why the Ubuntu Network is all about that kind of stuff, because we talk about hard skills and soft skills in medicine, don't we? Hard skills, like all the skills you can do, like LPs and chest drains and all that stuff. And like, you should be competent in most of those things by the end of a certain time of number of doing them. But, you can never be prepared for that 75th person you see who's got psychosis. and they're 78 years old, or whatever it is. Every time you have that interaction, it's different, and those soft skills are really, really important in expedition medicine, because things with expedition rarely happen very quickly. They're a development over time. We talk about haste, HAPE, like frostbite. These are all things that take time to develop, and most of what you're dealing with on expedition is coughs and colds, diarrhea, gastroenteritis, all that kind of stuff. These aren't things that just kind of happen straight away. They're things that, you've got a bit of a cough and a bit of cold. All right, let's try this, let's try that, and then they go a bit higher and they get a bit worse, and then you're like, now it's progressing to a bit of HAPE. Oh, that's interesting. Let's give them some oxygen. Let's keep them at the altitude. It's constant thinking. And those skills kind of not really diagnosis, but like those clinical skills are really important. And I feel that I got most of that from my work in Scotland and New Zealand, because again, you're not relying on a CT scanner to tell you that they've got fluid in their lungs. You're listening to their lungs, you're listening to their story, you're watching them walk. You get so much more insight, and that's what I really find fascinating about expedition medicine. It's just a different type of medicine, really.
Moving to the end of our discussion now, I want to find out a bit about your tips and advice for medical students who might be interested in expedition medicine after hearing kind of your experience and the different things you can get involved with through this career. What would your advice be?
It's a tricky one. I obviously didn't come from it kind of from being in med school and doing kind of focus on expedition medicine, but there are expedition groups in kind of medical schools, I believe, like societies. Is it what they call WEM societies, aren't they?
Yeah. Okay.
Yeah,
definitely.
Wellness Expedition Medicine Societies. So that's a great way to kind of get involved with that kind of stuff. Obviously, you've got your SSC portions during your degrees, and I've no doubt that kind of getting in touch with people and kind of doing papers on altitude medicine or stuff like that would be really cool. How practical it might be, I'm not sure. Obviously, it kind of requires research going kind of abroad, etc., or maybe you could use research that's been collected if that's an interest for you. And then I guess there's lots of different, because there's no structure to the expedition medical kind of field. There's kind of 1,000 ways of going about it, but you could do what I did and get involved with some kind of local races and see if it's something that you're interested in. And there's multiple groups like TrailMed, XL Medics. They all do kind of they cover the races around the UK. If you fancy kind of learning something about expedition medicine, obviously there's the diploma in tropical medicine with Liverpool. There's also one in London, the School of Hygiene. Then you've got kind of diplomas in expedition medicine itself. The University of South Wales, Exeter run one, Glasgow run one. So there's lots of opportunities for like lots of learning. And then I think the next thing is just to kind of get involved with different groups that are active. So Endeavour Medical, WEM, Ubuntu Network. There's loads of us out there. There's loads of people to talk to about expedition medicine. If something you want to pursue, then have a chat with someone who's doing it. I think that's the best way to go about it. But like I said, there's a million ways to go about it. There's no right way at the moment of getting there. But just make sure that you're competent in what you're doing, and don't sign yourself up to something that you're not kind of qualified or competent in doing, essentially. Yeah.
Thank you for that advice. Yeah, and just for any listeners who aren't in the UK, an SSC is a student selected component. So it's a block we have in medical school that allows you to choose, and I'm sure there are equivalents abroad as well. So the High Impact Medicine podcast, we try and figure out why you made the decisions you did, and I think we've got a good idea of why you got interested in expedition medicine and your experience of it. Did at any point you think about the impact you'd have, or like a wider impact of this job?
Yeah, I think the impact initially was unclear to me. I think initially I went into it for selfish reasons, because I love hiking, I love expedition, I want to go and do an expedition for free. That was where I came at it from. And I think that's a very valid reason to come at something from. I've given time, money, effort to this, and I want to get something out of it. And I enjoy talking to people, and that's why I do ED. And I enjoy hiking. That's why I go hiking on my own and hiking with my partner and things. So how can I combine those things? That was my main thought. And then I think the impact that arose when I was actually on expedition was, how can I facilitate these clients' dreams? So they want to go up a mountain, or they want to climb this peak, and how can I make that the most comfortable thing? How can I facilitate that? I'm here for a job, and you're there as a paid person in terms of your expenses are being paid for. So So you should do your best to kind of facilitate that. So that was my next point. And then it came to the final bit, which was, how do I help these people who aren't clients but are the local people? And actually, that's where my heart is now. And I think, albeit we've set up the Ubuntu Network and I've been involved with lots of discussions with lots of people about expedition medicine, actually, the people that mean most to me during these expeditions are the local populations. And that is where I'm trying to transition to now in terms of having the most impact. And I think my transition now will be more towards humanitarian medicine and working on how to give the best we can to people who don't have and who want, because if they need it and they want it, then I don't see why they shouldn't get it. And to facilitate that as a doctor, I think is a really powerful thing. So that doesn't mean I want to impress on people. Certainly don't want to do that at all. But like I said earlier, the biggest kind of reward I've had through these interactions has been with local populations, and I want to continue to do that throughout my career.
Okay, of all the things you've done so far, what are you most proud of, and what do you think has done the most good, and why?
I think the thing I'm most proud of, which is a bit weird, but I think it's getting to where I am now without perhaps following the status quo, because I think there are lots of us who don't follow the traditional path but do good things. I'm not saying I do good things, but there's lots of guys and girls who work out there in various jobs who are not just thinking about themselves but are thinking about the wider community, and they're trying to better themselves to help in a different way. And whilst I think that training is great and it's very structured, and you should go through the exams to get to the top, I just don't see the attraction of running to the top right now. And actually, I think there should be more support for the guys and girls who do the non-direct route. And I'm proud to be one of those people, because I think it's given me a lot, and I hope that I've given a lot to other people as well, be that in work or in my expedition job. So yeah, I think don't always follow the easy path. I think that's probably what I'm most proud of.
That was great. Thank you. That's good advice. And I think we've covered a lot of ground today. I think I've learned a lot about what expedition medicine is, the realities of being a doctor, but also how it doesn't actually fit into training, or it's not as, it's a pretty new field, and there's kind of a lot of work that you're doing yourself to try and build this network and community, so that there is more of a place for it for medical students that are interested in going into it in the future. So that's really exciting work that you're doing.
Definitely. Thanks so much.
Great.
Thanks so much for this.
So much.
This has been great.